Hello guys, today we are going to discuss glycogen storage diseases. My name is Abrar Pathan, so let's begin. We have five types of glycogen storage diseases. First is the one gierke disease. This is caused by the deficiency of glucose 6 phosphatase enzyme. Then second is the Pompes disease. This is caused by the acid maltase or alpha glucosidase deficiency. Third is the Cori disease. This is caused by the debranching enzymes deficiency. Fourth is the Anderson disease. This is caused by the branching enzyme deficiency. And fifth is the McArdle's disease. This is caused by the deficiency of muscle phosphorylase. So guys, first of all, we'll discuss the type 2 because it is unique. It is unique in case that it is also a lysosomal storage disease. Okay, and there is this enzyme called acid maltase or alpha glucosidase, which converts uh the 2% of glycogen present in cardiac and skeletal muscle into the glucose. Okay, so this present cardiomegaly, respiratory distress and failure to thrive, and classically the floppy baby syndrome is seen in this Pompes disease. Okay, now guys, in order to understand the other glycogen storage diseases, we must know the steps of glycogenolysis. Okay, it means breakdown of glycogen into glucose. Okay, so first of all, glycogen it gets converted into glucose 1 phosphate via the enzyme called as a glycogen glycogen phosphorylase. Okay, then this glucose 1 phosphate is again converted into glucose 6 phosphate via the phosphoglucomutase. Okay, and this is a reversible step. Okay, and this glucose 6 phosphate it gets converted into glucose via the enzyme called as a glucose 6 phosphatase. Okay, so guys, you need to remember, okay, if this glucose 6 phosphate enzyme is deficient, okay, we can't break the glucose, we can't normally produce glucose, so we'll end up with hypoglycemia. Okay, and also exercise intolerance, like when we try to exercise, will not do, like there will be a failure to do exercise. Okay, then yeah, and debranching enzymes, these are the enzymes which will cleave the glycogen into glucose. Okay, and these are the glucan transferase and one is glucosidase. Okay, so so when these enzymes are deficient, we get type 3 Cori's disease. Okay, so hypoglycemia causing GSD, that is glycogen storage disorders, are the type 1 and type 3. Okay, hypoglycemia with exercise intolerance is caused by the GSD type 3 and 5. Okay, and neither hypoglycemia nor exercise intolerance type 4 and type 4, that is a Anderson disease. Okay, now let us talk about the type 1 born gierke disease. So in this there is deficiency of glucose 6 phosphatase. Okay, so gluconeogenesis and the glycogenolysis are affected. Okay, both the pathways which will uh, which will produce glucose, and they'll increase the glucose in the blood, they are not they are not working. Okay, so they are affected. Okay, and so we'll get hypoglycemia. Okay, hypoglycemia, why? Because these two pathways are not working properly. Okay, so the features are doll-like faces. Why? Why? Why doll-like faces? Because there is deposition of triglyceride and cholesterol in adipose tissue. Okay, and also we can see the xanthoma, ketosis, lactic acidosis, and the hyperuricemia. In the type 1, that is the 1 disease. Okay, so so remember that there is a deficiency of a glucose 6 phosphatase enzyme. Okay, and and this disease is will cause hypoglycemia and the exercise intolerance. Okay, now type 3 Cori disease. So this is caused by the deficiency of enzyme. Debranching enzymes are deficient, so glycogenolysis is impaired. Like breakdown of glycogen into glucose is impaired. Okay, but gluconeogenesis is intact. Okay, so the clinical presentation is like similar to the one gierke disease, but milder symptoms and normal blood lactate levels are seen in this case, and this can lead to cardiomyopathy, limit dextrin-like structures occurring in cytosol. Okay, now in type 4 Anderson disease, we have branching enzyme deficiency. So this is in more relation with the glycogen formation. Actually, the glycogen is formed from the glucose. Mm, Glycogen is composed of two molecules, glycogen and the glucose. Okay, so when this glucose is attached to the glycogen via the two bonds, alpha 1 4 and alpha 1 6. Okay, so this process requires the uh, enzymes. Okay, like branching enzymes. Okay, so if this if this if this enzymes are deficient, then we will get this Anderson disease, and this presence with the hepatomegaly and in later stage we get cirrhosis of liver. Okay, ठीक है? So in this case there is no hypoglycemia or exercise intolerance. Okay, now type 5 McArdle's disease. In this case we have the muscle phosphorylation deficiency and increase in glycogen in muscle, but muscle cannot break it down because of a deficiency of muscle phosphorylase. Okay, which will result in painful muscle cramps and myoglobinuria, reducing with external exercise, and arrhythmias from electrolyte abnormalities, and second mind phenomenon noted during exercise due to muscular blood flow. So guys, this is the summary of all the glycogen storage diseases. So please pause and try to recall all the GSGs, and that's it. Thank you for watching. Bye.